In less than 24 hours, an historic deal to expand access to affordable health care in our state is likely to take the first step forward. State lawmakers are set to take their first vote on expanding Medicaid. Thanks for staying with us. I'm Lena Tillett.
And I'm Dan Haggerty. North Carolina is one of just a dozen states that has not expanded it yet. WRAL's Capitol Bureau Chief Laura Leslie joining us from the state legislature to explain the next move to change that. Laura.
Dan, the bill that's going to be voted on tomorrow in the state Senate would expand coverage to people who are in what's called the Medicaid gap. That's people making between 100 and 133% of federal poverty line. Advocates for this population are urging lawmakers to act quickly. They say expansion will absolutely save lives. For the past decade, Republican legislative leaders have rejected Medicaid expansion, saying it could hurt the state financially if the federal government cut funding. It's become clear that that's not likely to happen. The delay has cost some North Carolinians their lives. Dr. Eleanor Green, an OBGYN in the Triad area, says she lost a patient to cancer a few years ago. The patient put off getting medical care for a year because she didn't have any insurance.
She continued to work until she was able to get insurance, and she did get a policy and came in. And when she came in, it was pretty devastating because when I examined her, a large portion of her cervix had been destroyed already by cervical cancer.
Dr. Green said if the patient had health insurance, she could have come in when symptoms started and potentially caught and treated the cancer before it spread. But like a lot of working poor people, Green said, she decided to wait.
They think about, well, I'm just paying my bills. If I go to a physician, then I'm going to have another big out-of-pocket bill, which I can't afford. So some of them just don't go because they're afraid that they won't be able to pay the bill.
Dr. Green's been talking to lawmakers for 10 years, trying to convince them to expand coverage to this group. She was thrilled to hear about the deal. She says it will save lives and save the state money because problems can be caught earlier.
I'm so happy about that they're coming together to help their constituents, which they have been voted in office to serve these constituents, regardless as to what party they're in.
Now, the Senate is expected to vote in favor of the bill tomorrow and then again Wednesday. It then goes back to the State House for one final vote there. It could be on its way to Governor Cooper's desk by the end of this week, but it cannot take effect until this year's state budget becomes law. Dan?
Still some hurdles to jump, but we are on the right track for people who are excited about this. Laura Leslie, thank you.